So, welcome.
Wait.
Okay, we're going to go ahead and get started. All right. This is Dr. Khan, Executive Plastic Surgery, Northridge, California. So this is my second case for the day. So this is a nice 55-year-old patient with history of left breast cancer. She ended up getting alloderm, which is cadaveric skin reconstruction done. And then ultimately a second surgery, third surgery. They used Flex HD as well, which is another device that was mesh that was used to reconstruct. And then she ended up having replacement, and she was not happy with her results overall. And so as you will see, this is a relatively very large implant on the right. This is the right mastectomy scar with the suture at 12 o'clock to orient. So this is medial, this is lateral. And you can see her skin was very much attenuated, very thin. And I had to remove the artificial nipple that she had, and plus that really very thin, attenuated, pushed out skin, so compromised skin. So the further down I went, the better skin. The further up I went was better skin. So I was able to put that together with an ultimate aesthetic flat chest closure. So you will see relatively very large implant. The entirety of the implant capsule, all inflamed tissue has been removed completely, definitively, sincerely, in what is en bloc fashion, the gold standard, complete en bloc, 2A26, initials EJ. And so what I'm going to do now is I'm going to go ahead and cut this open. And as you will see, the entirety of the implant capsule was removed as one system in en bloc, the gold standard. Now, very unlikely, her implants are not that old, but still, the goal here is to remove it completely such that there is no capsular tissue remaining behind. Now, if I take this ruler and I put this in here, you will see literally how thin this capsule is. No matter how thin, it has to be removed. That's the whole essence and gist and goal of surgery in my practice, certainly. And so if this implant could potentially be ruptured, but we know that it was done in what is en bloc fashion. So if there is any fluid inside, it was all contained. And you can see how it's kind of all bunched up together. And this is consistent with this implant capsular contracture, because it's contracting the implant. So what I'm going to do is I'm going to open it a little bit more. And here we go. And you will see how it's literally bunched up together. I'm going to pull this out. Intact, very large implant. This is the Sientra, just like it said. So Sientra 625 implant. This company is no more. And as soon as I turn this around, you will see again, look how thin this capsular tissue is. This is your alloderm right here. Alloderm piece. And you have more of this capsule skin. Anything abnormal, anything that palpated abnormal, you can see these islands of alloderm. She had what was a capsulectomy, given the operative note that she came in with, more alloderm. So I knew what was done before, and anything abnormal, looked abnormal, felt abnormal, palpated abnormal, my sixth senses was abnormal, I removed it. So overall, as you can see, intact large implant. Now I'm going to remove my top glove, and we're going to go to this left side. This is the side she had breast cancer, so this is the side I did second. You can see, look how nice and white and round this is, and how contracted this is. And so I'm going to go ahead and get another pair of pick up sterile, nice and clean, because remember, I want to get like a good representative culture from the inside. So I'm going to cut this open. No matter how thin the capsule, it has to be removed in its entirety, definitively. I'm going to turn this around. And again, what is an intact implant? It was just done a few years ago. That was her fourth surgery. And you can see right here how thin this capsular tissue is. All of it removed. Very thin attenuated flaps. And again, you can see how the implant is literally suffocated with the capsular contracture. The entire implant capsule, all inflamed tissue. Look at this irregular abnormal tissue. It's actually very hard. I'm going to cut right through it. Maybe just checking for any cystic fluid or anything like that. No, none. And you have to always assume the implant is ruptured. You have to always assume there's fluid around the implant because we do not want that to spill, and that's the whole purpose behind the end block. So I'm going to go ahead and remove this very large implant. And again, Sientra 625 intact silicone implant. And if I may, you can see there is some bleaching of the silicone. And again, very thin capsule, semi-is thick. And the entirety of this capsular tissue has been removed with definitive certainty, leaving behind only good tissue, and all bad inflamed tissue has been removed. So overall, I'm very happy with the minimal blood loss, literally 5 cc's on each side. No need for the drains. And overall, the right and left mastectomy scars will be sent to pathology given the history of left breast cancer to be complete. Right and left breast implant capsules will be sent to pathology, rule out that rare BIAL, CLCD for the analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, cultures for aerobic, anaerobic, and fungal. And implants will be returned to the patient, and most importantly, we'll see how the patient does post-op, minus these toxins, minus the inflammation, minus the weight of the implant on her neck and back. She was absolutely not happy at all. So she came from Northern California for her surgery, and very happy and content. We had a lot of good, healthy discussion a couple of days prior to the surgery on Friday, and she did her homework and understood exactly how I did my surgeries. I did them in the manner. As she gets done with the surgical procedure, she has an absolute peace of mind and contentment that the entire implant capsule, all implant tissue, alloderm, flex, HD, anything foreign was removed. Only good, healthy, viable tissue was remaining behind. And number two, all bad tissue that was removed is going to be tested so we know what it is and what it is not. This is Dr. Khan, Executive Plastic Surgery, California.